里是中方红十字国际医院。我身边这位是来自比利时的国际友人莉亚。她来我们医院呢，主要是来学习这个中医。莉亚呢，她是第2次到我们医院来。第1次是2009年，曾经过来学习了中医基础，这个中医诊断这方面的课程。这一次是第2次来，主要学习了中药和方剂学，中医内科，也这个做了一些初步的学习。
Hello, this is Zhongfang Red Cross International Hospital, and this is Leah, and this is Dr. Lily, also the director of the International Training Department and the section chief of the medical department of Zhongfang Red Cross International Hospital. And Leah, she used to come here in 2009, and she has learned the some basic knowledge about TCM and also some diagnosis of TCM. And this time, Leah has learned the Chinese herbs and internal medicine of TCM in our hospital. Now we warmly welcome Leah to talk something about her experience here.
我喜欢谢谢红十字医院。Now I speak in English. I continue in English because my Chinese is a little bit more approved, but it needs more study. I would like to thank the whole hospital, the staff from Dr. Lini, and the first time it was under the direction also of Dr. Meng, and I was very aroused. I was very satisfied about the study and the training I received, and therefore I came also a second time. My big interest now is more to the Chinese herbs, and I suggested it to do, and they have agreed, and therefore there was a very good staff. It was, I think, Dr. Yang who was the introducer of the Chinese herbs and also the further study of the TCM. You need to translate? Okay, I continue. The study of the Chinese herb was for me, for one part, refreshing. I have done the study years ago in my country, in Belgium, and therefore I was looking for a good refreshing for the herbs, and this was a very good refreshing. So also the translating by Mr. Stone, I was very satisfied. I must say, I very good agree the way he did the translation. And also from time to time there was a discussion about some points, and that was very good. So with the translator together, and we could very good approfond it. So there was a second part also, that was the practical thing of the Chinese herbs. So we went in the formiddag and in the afternoon also, 2 times a day, we went in the pharmacy for the practical
Yes.
study. And there we make photographics from all the herbs.
And also some samples.
Yes,
Yeah.
and I was allowed to take samples from the Chinese herbs, which I am very satisfied that I may do it and even taken them to my country. That I found is a very good way of studying the theory and the practice, very good together each day, each morning and each afternoon. So there was also a practical thing about the composition of the formals which we have to make for one formal practical, and then to practice to weight each kind of herb, the unit for that day, and that for the whole formal, and put it together. That was very good basic practical. I have never done it so specific, so practice, and therefore I found it a very good, interesting point, the theory and the practice in the pharmacy. That was very good. There I see there is another kind of thing who must be approfounded. This is, you have the former, you have the diagnose, and then you have also the patient. So
Yes.
it should be also interesting to do during the day a moment that you go with assistance of the doctor who has his responsibility, and you have the diagnose, and so you have the formal and the discussion of which adaptation of the formers are doing this week or during a period of 1 month, for example. This is the continuing that I have not yet done. That I, yes. And other point what I found also interesting is the document I received is a little bit in generally. Yes. Maybe it is interesting to have more specified. For example, now it was about Chinese herbs also, and also to mark the hours of the period of the stage during such kind of weeks, such kind of hours you have done. And maybe also in the specification of the paper, it's interesting about TCM to speak also about the degree that I have already had before. Because I am a member of the Belgium Acupuncture Federation, I have an official number. So, on the paper, maybe it is interesting to mark that I am member. What is my officially member number? this is a little bit what I would like to put together from my experience that I have done in this 6-week training year. I am very satisfied, I must say, and I would like I may come back, and that there is a possibility for me also that I come back to do a further continuing and for about TCM and more specific for the Chinese herbs and the practice to the patient's selves, and in the continuing of the week or the time the patients or he, why they do first this and then they do that step, and just the following of the steps of the period they are here.
So you just need more clinical practice
Yes.
for what you have learned
Yes.
here.
Yes, the continuing of that.
Yeah, to solidate what you the knowledge about TCM. Yes.
Yes. So that was it for me.
So now just Miss Leah just share with us her experience, the study experience here. Yes, talked much about, and also provide some good advice for us about the maybe the documents, the textbooks for students from other countries to learn TCM. So anyway, thank you, Leah, for your experience.
Thank you very much.
Thank you very much. I think